here is your question. Right.
I'm next.
It's just this one,
Okay.
one page. Right. So if you have read and understood, considering it communication skills station, kindly begin.
Hello.
Yes.
My candidate number is 66.
Yes.
I'm Dr. Jahan, working under Mr. Mann at King's Hospital, and I'm willing to talk with Mr. X of
Yes.
King's Hospital about a patient, as the patient wants discharge again medical advice. Can I confirm that I'm talking with Mr.
Yes.
X?
Mr. X speaking. Yes, please. Can you summarize
Thank
your case?
Yes, thank you for responding, sir. So, Mrs. Y, she has a she's second postoperative day of mastectomy and axillary clearance for breast cancer, and a previous history of COPD and mild left ventricular failure. Now she developed axillary swelling with shortness of breath. But now, actually, she wanted discharge again medical advice. I have talked with her and her daughter also, but they don't want to stay in the hospital. That's why I called you.
Have you tried to rule out if the patient has made the decision on her own, or has she been bullied into making this decision of going home?
According to the situation, I think the daughter has convinced her to take this decision. But the patient is wants to go to her own house after discharge from the medical. But I think somehow the daughter convinced her to get the discharge.
Okay, when you're telling that she wants to go to her own home, then you should tell as well which is located how many miles away.
60 miles away.
Yeah. So have you tried to rule out if the patient is sufficiently alert to make this decision?
Yes, she has competence to make an informed consent, as I have talked with her and she has summarized all the things and we discussed it later. So I think she's competent to make her own decision.
Why do you think, what do you think patient has happened to the patient? Why do you think patient has shortness of breath?
As she has a previous history of um, chronic obstructive pulmonary disease, so there may be a chance of acute exacerbation of COPD, and there may be a chance of, as she is a post-operative patient, there may be a chance of pulmonary embolism as well. And yes,
And there is more you have to tell.
and reactionary hemorrhage may be occurring here in the wound site.
Okay. And there is, have you noticed if the patient has still the drain in situ?
Yes, in the draining, actually, there is 90 ml of fresh blood in the drain.
Okay.
So there may
clear
be a
blood?
chance of reactionary hemorrhage or hematoma on the wound site.
Yes. All right. Good. Okay. Can you tell me what are your plans of action?
Yes, if first of all, I would like to send full blood count for this patient to see the hemoglobin level. And for the reactionary hemorrhage, we have to evacuate it. Then, if it is a chance of PE, then I have to do the CTPA to exclude pulmonary embolism, and chest X-ray, duplex of the arm to uh, exclude the deep brain thrombosis. And I will talk with my consultant, chest physiotherapist, I will talk with ITU register also, and anesthesiologist.
Just physiotherapist and medical registrar. All right. Can you tell me what would you do if patient insist on going home?
Yes, I will inform patient and patient's daughter about the possible complication can occur if they take this discharge again medical advice, as their home is 60 miles away, and I have to tell the patients and the patient daughter about the warning sign, that the patient may be sick again, as she has past history of COPD and left ventricular failure, and there is also a reactionary, there may be a chance of reactionary hemorrhage as well. And I have to state that to them, they have to sign a legal document stating that they are taking full responsibility, discharge to this discharge again medical advice.
And what else would you do?
I have to write a letter to her GP also.
Yes, and who will
And
be taking care of the patient if patient signs the legal document and goes home? Who would be responsible and taking care of the patient?
her daughter, first of all, as she is
She
taking
has
her
to go back
with
to
home,
she has to go
and
back to her
and
bed. You
yes,
will
and
talk
also
to yes,
I will talk with social worker.
yes, social services. Very good. Right. Who would take care of or take the responsibility of the drain? Would you send the patient with the drain on, or would you remove it?
I will send the patient with drain, because as there is a collection 90 ml of fresh blood in the drain, so I will send the patient with drain, and I will mention it in the letter to the GP.
Okay. Right. What is the hemoglobin level at the moment? Have you checked?
I'm really sorry, I don't have this information right now, but when I'm off the phone, I will check it and let you know.
All right. Has the patient signed the forms yet?
No, I will talk with her regarding this.
Do you think patient might have had a COPD exacerbation? Have you ruled that out?
Yes, I want to do a chest X-ray.
Yes.
To exclude the COPD, and
all right. Okay. So can you summarize everything that we have discussed so far?
Yes. So Mrs. Y, she is a patient of post-operative 2 mastectomy with axillary clearance for breast cancer, previous history of COPD, and mild left ventricular failure. She has fresh blood in her day, 90 ml of fresh blood. But she is not interested to stay in the hospital anymore, and she wants discharge again medical advice. And I have talked with you about the complications of this patient, and the patient and the patient's daughter will take the responsibility after that. And yes, she want discharge again medical advice.
Yes. So if patient will sign the legal document, you will send the patient home. Okay.
Okay, thank you, ma'am. Thank you so much.
You still have 30 seconds left. If you can tell me, if there was, instead of mastectomy, there was only lumpectomy, lump was removed, how would the management differ?
For lumpectomy?
Yes. Or for this patient who wants to go home against medical advice, and instead of having whole mastectomy, had only lumpectomy.
And she has this drain or not?
Yes.
She has the drain.
Yeah, drain with seroma, not blood, like you are telling me. She is having blood, so in that case, she is only having little seroma. But would you send her home, or would you still want to keep her?
I would try to convince the patient to stay in the hospital.
Yes, like you're doing now. In this case, if there was hematoma, how should that have been managed?
It should be managed by a surgical evacuation of the hematoma.
There are axillary swelling, so there is possibility that this hematoma needs exploration.
Yes, surgical exploration.
Yes. Right. I think most of the things you have covered. It was, yeah, good. Thank you.
Thank you, ma'am.